Yes, Dr. Isa, please. Sorry, because the light in my eyes, I cannot see you.
Thank you. Good morning. Thank you for the very informative talks about what's coming in this area. I would like to ask Dr. Fry about when we first looked at that scan, it was released in Europe, the impression we had that it has to do with the loss of the neurons that are dopaminergic. Now, are we looking at the loss or maybe some kind of reduction of a receptor or a molecule that can be regenerated in these patients?
Thank you. So I think the issue really is a distinction between clinically relevant measures versus for the purpose of research. Fluorodopa, DAT scan, and the vesicular measures all will separate patients with a lesion, that is Parkinson's disease, from normal individuals or those with essential tremor. And the degree of difference is so great that these regulatory changes that may occur, which are only a few percent, do not interfere with the use of any of these agents. So I would say DAT scan is the same as the tetrabenazine, is the same as fluorodopa from the standpoint of separating patients with a lesion from those without. The relevant differences are, can I obtain the tracer, and to some degree the imaging aspects in terms of image quality. So what I've tried to share with you from a research standpoint is particularly with very small changes, for instance, changes over a year or two in a patient with Parkinson's disease, we need to be very careful about whether those changes are really due to a further small loss of nerve cells or whether those same changes could relate to a response to drug treatment or other regulatory change in how many proteins we can find.
Yeah. Any other question, please?
I have a small question for Dr. Mishal. What is the prevalence of the movement and the degenerative disorders here in Kuwait, and what is your imaging modality which you're using for the management of these patients? Like a brief overview.
Yeah, actually, we didn't have actually a study to document in terms of the incidence and prevalence, but in the coming actually few months and a year, we're trying to put a database for that actually, because like in Kuwait, you have Ibn Sina Hospital, which has a movement disorder clinic there, but actually in other general hospitals, Adan Hospital is the only hospital in Kuwait which has the movement disorder clinic. This is the second one, so actually, and it's very busy. So in the next like a year or so, we'll put a database. Now, in terms of the imaging techniques, as I mentioned, if you have a patient with typical Parkinson's disease, I don't image them. But if it's a young onset, what I do actually, because there's something, Wilson disease. Wilson is, believe me, I have diagnosed 2 cases of Wilson in Kuwait. And you take the case of Fletcher rings and you do MRI, they're typical lesions, and they can present with PD, psychiatric manifestation, all this stuff. So usually, unless it's young onset, atypical, you don't feel comfortable, you do MRI. But if you have typical PD, no need for MRI, elderly. The other thing is that in terms of DAT imaging, actually, I don't order DAT imaging at all, but I have few patients with essential tremor, it's a bit iffy, which I want to do the DAT scan, and that's why I'm pushing it. I want the DAT scan in Kuwait, which is, what I'm saying, it will help you.